Hey everybody, Dan Trumbley here, Director of Communications and Creative Services for Senior Market Sales. I'm here with Dwane McFerrin, our Senior Vice President of Med Solutions. And we're here to just have a conversation about a lot of the things that are going on in the industry right now, particularly with the Medicare regulations. A lot going on, a lot of people wondering how these new changes are going to impact their business and their clients. We have the CMS regs that just were passed. Also, the Inflation Reduction Act that maybe people aren't talking about as much, but maybe has just as big of an impact on the industry. So we're going to shed some light on some of those things for agents and kind of get into maybe some of the questions that they might have, and we want to try to give them answers.
You know, I've been in the industry now, Dan, for over 40 years, and this is as wild and disruptive of a period as I recall in the industry. So it's extremely important for agents and agencies to be aware of the changes that are underway, the impact that will have on running business, and also the impact on your clients that they'll face this fall.
Yeah, and you and SMS have really been on the front lines, so to speak, with all of this stuff, trying to advocate for agents. You guys have been very plugged in to what's going on in Washington. So I think you have a lot of insights to be able to share with people.
We've been really fortunate, right? We've spent years in Washington working with NABIP, formerly NAHU, and becoming known within the industry as being a real supporter of agents and brokers. And so fortunately, we have some influence and people listen to us. And so I've had the opportunity to meet with CMS, with House Ways and Means, key staffer, elected officials, and even the OMB before the final regs were published by CMS. And so we've been able to have those conversations and really tell our story. Because so much, especially in the CMS regulations that came out, it was clear there wasn't a good understanding of what does an FMO do, what does an agency do, and what's the difference between that and an agent. And so we've been telling our story, and I think we told our story pretty well.
Mm-hmm. Yeah, so let's maybe get into a few of these things. Maybe we can start with the CMS regulations and just kind of dig into that a little bit. So probably a question that we're getting a lot from agents, a lot of agents are asking is, when are we going to know how agents and agencies are going to be affected by all this?
Well, the CMS final regs were published, I believe, April 4th. Now it's up to the carriers to interpret that 1,300-page document and decide how exactly does that impact them in terms of their policies and their procedures. So we'll know more probably by the second week of May on how carriers are interpreting it. They have to file their products by June 4th. So this is a big factor, is how do people get paid? What expenses do they incur? So it's a little more clear on the agent side than it would be, say, on the FMO or on the MGA side on how carriers are going to implement it. But we know one thing. We know that the cost of doing business is going to go up for agents, because fees like HRAs or maybe AHIP fees or even appointment fees could be charged to the agent. So while they get an increase in compensation of $100 for new and $50 for replacement, what's not clear yet are what are the expenses that the agent will incur that they'll have to use that extra revenue to offset. So we know that agents are affected, and I think the basis of the CMS regs was really all about making sure that there wasn't undue influence, that a carrier paying an agent more, for example, perhaps through other methods like a fee, would perhaps steer them to representing one carrier versus the other. So I think the noble goal of CMS was to create a level playing field. I think it's hard to argue with that intent. The other factor would be is FMOs and how FMOs are included or excluded. And there was page 591 and 592. I can't believe I would quote a page number, but
out of 500 pages in.
Yeah, out of a 1,300-page document, right? The page 591 and 592 explicitly excludes FMOs from the regulations governing this whole steerage and the commission payments. So our lobbying must have worked, because the proposal went from $31 to $100. So agents got more as a result of all the lobbying, really explaining the role of the agent and the support that's provided by the FMO, resulted in a higher amount. And now we have the question of how do carriers interpret the FMO, the admin fee, if you will. So an admin fee is not the same as an override. So it's more of a fee that's paid to the FMOs for all of the variable costs that the carrier would incur. And what they've done essentially is they've contracted with an FMO or an MGA to perform those duties, whether that's commission payment, or it could be the contracting or the training or the recruiting, the types of activities, the technology that an FMO would provide. And so how that gets accomplished remains to be seen. We will know soon on how FMOs would occur, but things that you see out on social media are really unfortunate, because in some cases people are making statements that it hasn't been finalized. And so until we really know how those carriers are handling those situations, any proclamations are really premature.
Yeah, and so you mentioned a number of things there, 1,300 pages, a lot of nuances, and really a lot still unknown as far as how these regulations as they're written are actually reality. So agents see $100 per app raise, but it may not be quite that simple as far as how it actually shakes out in reality. So a lot still to kind of unpack there.
Agree. There's the whole idea of what expenses will an agent now incur, and things that perhaps they received as a free service they may be charged for, and getting all that laid out. It will be well known before the AEP begins for 2025. But this summer months will be very interesting because carriers have to develop product. They have to make assumptions on how they're going to operate. And one concern that I have on the CMS regs, when they increase the agent compensation by $100 for a new enrollment and $50 for a renewal or replacement, they did it on Part D also. And one worry, and we'll find out soon enough, is how many Part D plans will be fully commissionable? Can a carrier really support that type of structure? And the way the CMS regs are written, it's either 0 commission or 100% commission. There's nowhere in between. And so that's a big question mark for an agent, is will they be doing business for Part D, where in many cases maybe they don't get paid? And that would be an unfortunate outcome of this regulation.